Friends, in the present lecture, let's try to understand what is depression, the symptoms of depression, the causes of depression, the effects of depression if it is not properly and immediately treated, and similarly, the treatments available for depression. Depression is very common these days, more because of the challenges that we have to face in the present times. Depression refers to the mood fluctuations and short lived emotional responses to challenges in everyday life. Depression is the most common mental disorder. If tension, anxiety, the uncontrolled emotions, etc., persist for long, it leads to depression. And if depression persists for long, it becomes the root cause for many other medical conditions if not treated on time. So, depending on the severity of symptoms, depression can be categorized as mild, moderate, severe. Often, depression is a disorder that can last for several weeks, months, or years. Some of the common signs and symptoms of depression are anxiety, loss of appetite, disturbed sleep, low self esteem, poor concentration, the deep feelings of sadness, feelings of worthlessness, the appetite changes, a lack of energy, lack of interest and enjoyment of life, withdrawing from friends, temptation for excessive use of alcohol, engaging in the high risk activities, the disinterest in daily tasks, the slow response during conversations, abnormal sleep, sleep patterns, the suicidal thoughts, etc. So, looking at these symptoms and today's difficult life challenges, we can easily say that most of the people, most of the time, they are under depression, maybe mild depression, if not severe. Here are some of the main causes of depression. One, any past experience or experiences of physical, sexual, or emotional abuse, certain drugs such as the antiviral drugs, any past experiences of personal conflicts or disputes with close friends, colleagues, or relatives, grief arising from the death of close friends, colleagues, or relatives. Similarly, the major life events such as, say, loss of a job, divorce, or retirement, a family history of a depression, etc., etc. See, conditions that can get worse due to depression, or that is, if you are already have these medical ailments, it definitely they can get worse. For example, the arthritis, the asthma, cardiovascular diseases, the cancer, diabetes, obesity, weight loss, the physical pain, panic attacks, etc. And there are different types of depressions ranging from the chronic to non-chronic, mild to serious, mild to severe. All types of depressions, doctors say, are treatable. Medications, therapies, the lifestyle changes. Like this, there are many different treatment options available for the treatment. There is no generic depression treatment that works for everyone. So each patient will have a different treatment style, and it will depend on the severity of their condition. So some people will need just medicines, while others need a combination of medicines and also the cognitive behavioral therapy. There is no single test that can be used for depression diagnosis. Doctor can check symptoms and order a psychological evaluation. Usually, they will inquire about the sleeping patterns, moods, appetite, the activity levels, and the general thoughts. All these analysis, it will help the doctor to work out a suitable treatment plan. And depression can lead to other health problems. Physical examination and the blood tests may also be performed. And the severity of a symptom, it is an important criteria. So the more severe the depression, the more intensive the treatment needed. So it takes time to find the right kind of treatment. Counseling helps to evaluate the problems experienced by the individual so as to decide about the ways of dealing with them. And there are so many treatments, for example, the MBCT. So this is specially designed for people suffering from the recurring depression, and this is to break the negative thought pattern. And some other severe depression treatment options include the electroconvulsive therapy ECT. So this procedure involves passing off a carefully controlled electric current through the brain, which alters the brain's activity and relieves severe depressive and the psychotic symptoms. And similarly, the repetitive magnetic stimulation or TMS. So this is a non-invasive procedure. The patient sits or he reclines and an electromagnetic coil is held near the head. The coil then passes magnetic pulses to a targeted part of the brain. So this helps in altering and regulating the moods of the individual. So the procedure is associated with mild to moderate side effects such as temporary hearing problems, mild headaches, or even tingling in the face or jaw. So this therapy should therefore be conducted by professionals only. Also, the deep brain stimulation. So, in rare cases where the patient does not respond to the other treatments, this deep brain stimulation is used to treat severe depression. And similarly, the TDCS. So, this is the direct current stimulation with the help of a small battery operated as stimulator. A constant low strength current is delivered through two electrodes placed on the head, and these stimulate the brain activity and reduces the symptoms of depression. And the TMS, so this is the magnetic stimulation, the transcranial magnetic stimulation. So in this case, a coil is used to send the magnetic impulses to stimulate the nerve cells in the brain of the individual, the patient. And there are also so many other alternative therapies, the acupuncture, group therapy, music therapy, meditation, etc., etc. You see, the sensations in the body, they are felt like the electric shocks. So that is how all these treatments or the therapies work. The psychotherapy is under one of the major depressive disorder treatments. So there are several kinds of clinical depression behavior therapies such as the talk therapy, interpersonal therapy, similarly the cognitive behavioral therapy. So it can help you in adjusting with the present crisis, spot the negative thought patterns and behaviors and replace them with the positive ones. We have to develop positive interactions with each other, identify the ways to solve the problems, set the realistic life goals. So these are some of the guidelines to prevent the depression. So for more severe depression treatments, hospitalization may be required, and this can prevent the risk of harming more danger to life. See, there are several supplements which can help in creating positive effects on the brain and help in reducing the depression symptoms. The essential oils such as the wild ginger, vitamin supplements such as vitamin B and vitamin D. So it can also be effective in reducing the effects of depression symptoms. Also, some of the natural chemicals and the amino acids are like the hydroxy tryptophan or 5-hydroxytryptophan, what we call. So if this is present in required quantities in the body, if these things, the chemicals and the amino acids, they also help in curing the depression and they have the antidepressive effects. They are natural. Healthy food and regular exercise helps to have good blood circulation in the body. and it definitely aids significantly in the recovery process. So, depression does not affect an individual at a standard age. It is episodic and it can affect any person anytime. But generally, it's more in the early 20s and late 40s. So many people silently suffer from a depression. Early checking and early treatment from a reputed depression help center, it can definitely prevent the disease from getting worse, and it can prevent disastrous consequences like suicide. So one should take care of this. So thank you, friends.